I'm Beverly Razan. I'm the Senior Vice President of Public Affairs at COPIC. COPIC is a medical liability insurance company. It's the largest provider of liability insurance in the state. We insure from doctors, hospitals, safety net clinics, as well as community clinics. We work to try and be a convener to address issues collectively across healthcare providers to make sure that we're keeping and maintaining access to quality healthcare in Colorado. I've been doing this work at COPIC for 16 years. I've been working in policy from federal capital to now state capitals for the last 25 years. Business absolutely needs to be at the table around healthcare policy. Employer-sponsored health insurance plans make up the coverage of more than 50% of Coloradans in the state. These are significant impacts on our balance sheets, and it is imperative that we stay ahead of the policies that have such a big impact on our ability to do business within the state and keep our workforce healthy. The Healthcare Council is made up of hospitals. We are made up of even physicians. We're made up of businesses who have employer-sponsored health plans. We have health plans here. We also have pharmaceutical. We have a lot of different businesses as well that have an impact or are impacted by healthcare policy. The Healthcare Council takes up policy that has been introduced that'll have an impact on not only the access for our workforce to have access to health care, but also insurance. We're seeing a lot of employer fees as well as benefit coverage expanding, which, as I mentioned, certainly impacts our bottom lines and our ability to provide that coverage for our employees. As businesses, we work to try and manage our expenses in relation to our incomes on a regular basis. To not be involved in looking at the policies related to healthcare that are coming up and being passed within the legislature is just negligent. We need to be focused on controlling where we can and trying to look at making sure that healthcare and the cost to do business and provide those healthcare benefits to our employees is sustainable, and that we can make sure that our workforce has the ability to have access to health care as well as insurance.